Welcome to the Go Hard Chick podcast, your podcast for all things health and wellness for women. This is your host, Crystal Holmes, and it is my mission to inspire and empower women to overcome stress and prioritize their inner healing for improved energy, health, and confidence. Our focus here at the Go Hard Chick podcast is on the 8 pillars of wellness, which we believe provides a holistic approach to achieving a healthier and more fulfilling life. Join us as we explore a wide range of topics and tools to support you on your wellness journey. Welcome back, Go Hard Chicks. This is episode 140 of the Go Hard Chick podcast, and this is your host, Crystal Holmes. And today's episode is an absolute must listen for all of the powerful women out there who are navigating their hormonal health. But before we jump into this episode, Go Hard Chicks, I need your help. I'm excited to share that the Go Hard Chick podcast has been nominated for the Women in Podcasting Awards in the Health, Wellness, and Fitness category. This is a huge honor, and I could not have done it without all of you. Now, I need your support to bring this award home. Voting is already started, and for all of you all who have already voted, thank you. But it's open now. Voting is open now through October 1st, and I would be so grateful if you could cast your vote for the Go Hard Chick podcast and spread the word. Let's show everyone what this community is all about. Please check the show notes for the voting link, and let's do this. Joining us today in today's episode is the incredible Dr. Nicole Peoples, a board-certified physician specializing in functional medicine. She is here to break down the critical role hormones play in women's health, especially during those key transitions of puberty, perimenopause, and menopause. Dr. Peoples helps us understand that our hormonal journey starts early, and too often, many of us are left in the dark about what's really happening with our bodies. From the changes we experience during puberty to the often confusing and frustrating symptoms of perimenopause, she explains how these hormonal shifts can leave many women feeling isolated or even questioning their sanity. Perimenopause, for example, can last up to 12 years before menopause. And it brings with it mood swings, weight gain, and challenges in our menstrual cycles. You don't have to tell me. But here's the thing. These symptoms aren't something we just have to deal with. They're signals from our body that we need to understand. One of the key parts of our conversation that I was really excited about, Go Hard Chicks, centers around hormone replacement therapy, or HRT. Dr. Peoples provides some much needed clarity on this subject, and she highlights how new research has shown that HRT, when done correctly, can be very beneficial, especially when started within the first 10 years of menopause. We also dive into the different types of hormone replacement, from pellets to creams to oral medications, and Dr. Peoples encourages us to explore personalized options that fit our individual health needs and lifestyles. She also emphasizes how important it is, particularly for Black women, to be proactive in discussing these options with our healthcare providers so that we don't miss out on crucial conversations about our hormonal health. And as always, we can't forget about lifestyle. Dr. Peoples introduces what she calls the Peoples Life Prescriptions, which are 7 modifiable factors, things like nutrition, physical activity, and stress management, that can significantly impact our overall health and how we experience these hormonal changes. Go Hard Chicks, this episode is jam-packed with valuable insights, And Dr. Peoples' knowledge is exactly what we need as we navigate these complex and sometimes overwhelming transitions. So, if you've ever felt confused or left behind when it comes to your hormones, this episode is for you. So, without further ado, go grab your favorite smoothie and let's welcome to the Go Hard Chick podcast, Dr. Nicole Peoples. Welcome to the Go Hard Chick podcast, Dr. Nicole Peoples. I am so glad that you're here today. How are you doing today?
I'm great. So happy to be here. Thank you for having me.
I'm happy. I'm happy because we're going to talk some stuff about women and health and hormones and perimenopause, all the things
All the
that
things.
I'm going through, the listeners are going through. So I can't wait to jump into this conversation. And as I was chatting with you before we hit record, I am thrilled because you are a Spelman woman. I love to have my sisters on the podcast
Thy
because
name we praise. Yes.
yes. So I'm happy about this conversation. But I'm going to stop babbling because I want you to introduce yourself to the listeners.
Absolutely. So my name is Dr. Nicole Peoples. I'm a board certified physician in internal medicine, but I practice a specialty called functional medicine, which is how I describe it is integrative, holistic healthcare, where we get to the root cause of why people get sick. And it's a much different approach than my conventional training because I really work with women on lifestyle, on hormone replacement, on hormone balancing, on longevity. And so we're really thinking about what are the factors that influence people's health, what makes people well, and helping women adopt behaviors that allow them to live a long, beautiful, healthy life, free of disease, free of medications. I'm also a mother of three. I'm a wife and I am a daughter. And I say that because it really informs everything that I do. So even when I think about my daughter, she's going through puberty. I'm going through perimenopause. My mother is postmenopausal. And what I found in my own life, it doesn't matter how much clinical work I do, it's that real personal experience that has shaped my perception of what should we be doing for our health? What should I be doing for my daughter? What should I be doing for my own health? What should I be doing for my mom? That really fuels me. So,
yeah, I love it. And I mean, something similar is going on in our household. My daughter's going through puberty. I'm in perimenopause. And I feel like I had to tell her about a month ago. I said, look, I know you got some hormonal changes. I got some hormonal changes. We're going to have to learn how to coexist.
I don't even, my daughter, I mean, literally, it was a couple of times it took me to realize, oh, these are her hormones. But like last night was a prime example. She just broke down and cried because she couldn't find her lanyard, her little pass to get into the building. And I mean, she was on the floor. And I just thought to myself, my first reaction was, oh, she's overreacting. She's being dramatic. But then I realized, no,
Right.
these are her hormones. And I just had to sit there and be like, okay. Let's cry it out.
Right.
But it was that knowledge that it was her hormones that allowed me not to like take the other route, which would have been like, girl, get up. You ain't nothing wrong with you, which is the way that we most of us deal with our hormones, right? Like, oh, you should just ignore that.
Yeah.
So I think having that understanding really does help so that you can have those conversations so that our daughters don't grow up wondering what in the world is happening to me.
And yeah, I kind of grew up like wondering what in the world is happening.
Yeah, I grew up until 2 years ago. Still
Exactly.
wondering.
It was like nobody really discussed this change. I don't remember my mom sharing anything about it. I my doctor really didn't share anything. And now that I'm here, I'm like, what is really going on?
So that's not uncommon that people have no idea. I mean, like I said, it starts really early. We don't really even start talking to our children about their bodies and their hormones and the role their hormones are playing in the way that they feel And not just feel from like an emotional standpoint, but feel from like a physical standpoint, from their physical appearance to their, symptoms of either bloating or pain, all the way up until, they're in the fertile years. And, we do a little bit better about talking about hormones when we're pregnant or when women are trying to get pregnant, but I think we really do an inadequate job. But the thing that's so surprising to me is that all of those years of never really talking about it then culminates in this time period between the ages of 35 and 50, where things start to go haywire and nobody really knows what to make of it. Depression, anxiety, weight gain, fatigue, brain fog, and then chronic diseases, heart disease, diabetes, high blood pressure. So all of these things happen at this one particular period in our lives. And if you go to your doctor, they'll say, here's a medication for sleep. Here's a medication for diabetes. Here's a medication for depression, anxiety. And then you'll be on 5 or 6 medications by the time you're 45 or 50. And you're like, everybody's acting like this is normal. Like we're just supposed to, and the other side of that is maybe you don't have a chronic illness, but you just don't feel as sharp as you used to. You don't feel like you're able to do what you used to be able to do. You don't feel like your emotions are stable, like you're more labile, things that you used to be able to handle, you just can't handle anymore. And again, then you're made to feel like you're crazy, right? So you're either sick or you're crazy. And it was this epiphany that I was like, oh no, we need to start talking about this, and we need to start talking about it to Black women, because even though this space is a growing space, and there are a few practitioners talking about it. Even where I got educated, it's mainly white spaces. And it was for me where I was just like, well, who's talking to us? Like specifically saying, Black women, this includes you. This thing that you're experiencing, yeah, you're not crazy. Is there something you can do about it? Absolutely. So it's that space that I'm like really passionate about.
Yeah. And that's kind of why I started this podcast, because like you said, I'm a podcast junkie. I love health and wellness podcasts, but majority of the ones that I tend to listen to they're not really for us. And I just thought, well, who's talking to us, to women that look like me, educated women? I mean, I'm not dumb, but I realized there's so much about my wellness, my health and wellness, that I just simply didn't know. And I didn't know where to go to get the information.
And it's not your fault. Nobody knows. I mean, very
Yeah.
few people know. I'll say that.
Yeah, particularly, I mean, not only just this hormonal shift and perimenopause and menopause, but just everything.
About
Everything.
your health. Everything about
Right.
your health. And so it's interesting because in the work that I do, as much as I love to sit around, I'm a nerd in the sense of I like the biochemistry of things. I want to talk about the mechanisms and why things happen. And what I realized is that as much as I want to talk about that, really what I have to start talking to women about is their mindset. Because we've been indoctrinated so much into the current way of thinking that our medical system is like, okay, if there's something wrong with you, then you go to the doctor. The doctor has the answer. They're going to give you a solution, and then you can, live your life happily and without illness. And that's not really the way that things actually happen, but people still expect that. So I'm always having to say, okay, listen, you are your expert. You are your best doctor. You have to start to pay attention what's happening to your cycles. You have to know specific things about your body because you are your own expert. Your doctor then, and let me use that word doctor lightly, only because what your conventional doctor is trained to do, and I'm a conventional doctor, so I know, is that they're trained to identify disease and then prescribe a prescription or surgery. That was what I went to medical school to learn. That's what I learned, and that's what you come out with. And that's the reason why nobody's talking about it, because medical doctors aren't trained to talk about hormones. And then you're like, well, who should I go to talk to? Well, you have to get specialty training to kind of understand this. So then going back to the women and saying, hey, listen, you're the expert. And the thing that's going to make the difference is 2 things. One is your understanding of what your role is in this. And then number 2 is your lifestyle. There's not a drug. There's not a secret magic pill. You really have a lot more control than you think you do. There are some hormones I can give you that will help, and I'm a big proponent of that too. But the first step is really mindset and lifestyle.
Yeah, I would totally agree. Even with me, I have struggled with the idea that I am my own expert. I think we struggle with that because traditionally, we put so much trust in our doctors. And I think we expected them to give us the answers. We trust them, help me. Um, and just the idea, I think, to a lot of us of taking control, having that responsibility can be overwhelming. And we don't, I think I'm a little different, but don't tell me I have to eat well. I don't want to do that.
Well, no, that's a real thing, right? There are a couple of things to think about. Number one is that it's not hard. It's just different, right? I kind of equate it to cigarette smoking, right? For a really long time throughout our US history, smoking was normal. As a matter of fact, it was like your president had to smoke. You know what I mean? Like it was the cool thing to do. And it took a huge shift to get people to realize, number one, that cigarettes were bad. And then number two, that, it wasn't socially acceptable anymore. And it was that social acceptance part, which was the biggest thing, because you can tell people, oh, eating this way is bad. And that goes in one ear and out the other, because everywhere they go, the food that's available to them is going to cause disease. So there is this little hump, and it might be a big hump for people to get over, to recognize that our standard American diet, the way that what we consider to be normal, is a disease diet. And if you eat that way, then your trajectory in health is predictable. Mm-hmm. We know exactly. I could tell you as a physician, and I work in, the hospital a lot of the times. For the last 15 years, I've been in the hospital. And I can look around and I can say, oh, I can see the decline in people's health 10 years before they see it, right? So the thing that I think we have to get over is this idea that the normal that we have, mm-hmm. we are expecting that normal to get us to a place that is fictional. We're expecting the way we normally eat, the way we normally move, the way we normally think. And then when we're upset, we get to the other side of that and we're like, well, why do I feel bad? Why do I have insomnia? Why am I gaining weight? And it's because you've been doing what's normal. And so I've been trying to train people or teach people, we have to develop a new normal. We have to start thinking about these things in a different way so that it isn't burdensome. So that when you go into a place, you're like, oh, this is not what this isn't normal food. Like I need to find, where's the normal food? Where are the vegetables? Where's the protein? Where's the, the healthy fat? And then when your mind starts to think that way, then it's easier for you to navigate and you're not like fighting yourself to decide what I should be eating. Because it's not about diet. It's about really displacing an old way of thinking with a brand new one.
Yeah, it's a total lifestyle shift. That's what I try to tell people. And, a lot of times the pushback is, well, I won't be able to enjoy life. I want to enjoy life. I was talking to someone recently and God bless her, she shared with me that she eats out every day, breakfast, mm-hmm. lunch, and dinner, and not the most healthy things. And she's like, I know I shouldn't be doing this, but I'm so stressed out. It helps me with the stress. Mm-hmm. So like, true. Yeah.
No, I mean, it's biochemically true. Mm-hmm. It's absolutely true. Like there are certain foods that stimulate dopamine, and that dopamine is what makes us feel good, right? And so what people are describing is absolutely true. However, here's the caveat. At the same time people say this, they're also saying, I can't, like they're giving me a laundry list of things that isn't going well for them, right? I'm always fatigued. I'm always mm-hmm. tired. I can't seem to lose this weight. I can't, it's on one side, it's like, I want to have this happy life. I don't want to be miserable. And then on the other end, they come to me and say, I'm miserable because of all of these things. Yes. And you can see how those things don't line up, because the reality is that you're not as, you're not feeling good like you say you are. You are telling yourself that going out and eating and doing all of these things are making you feel better, but then you have no sense of recognition of how the things that you're doing is actually making you feel horrible. And so what I try to explain is that honestly, when you're honest with yourself and you sit down with a practitioner of some sort and start to break down, how do you really feel? Right. And when I do my intakes, they're like 2 hours long. My intake form is really long, because I really want to know, like, what's the truth about how you feel. And then we can make a decision about, okay, so how do you really want to feel every single day? So it's not just about so I can live longer and prevent disease in, 10 years down the line. The things that I recommend improve your clarity of mind today, your energy today, your bloating today, your weight gain today. So, once you get these core things down, which again, aren't that difficult, they're just a shift in mindset. Once you get these things down, you feel better today. And the side effect of that is longevity and health.
Yeah. Yeah. And with this particular person, initially she said, yeah, I'm ready to make the change. I'm ready to make the change. But then, like I said, I think whatever dependence she has on this food and managing her stress, she started to freak out about that. And she said, look, I I just decided I'm just going to be fat and happy. And I don't think she has any diagnosis yet, but I cringed and I just, I didn't want to lecture her about, well, you realize if you keep eating like this, it's not just going to be fat that you're going to be dealing with.
And so there are two ways to think about this, right? One, my default is I don't want to push anybody,
Yeah.
right? Like, I really require, like, even when to work with me, like, we do a discovery call, because the question that I have to know is, what is it that you want? And are you willing to do what it takes to get there? Because I can help you get there, but you have to want it, right? So even when people call on behalf of their spouses or their friends, I'm always like, nah, they have to come, right?
Yeah.
So there's that piece of it. Like, you have to be ready to make the change. But then the other part of it is education, right? Like you said, like, okay, you rather be fat and happy, and that's a choice that you're okay to make. But I would like you to, and this is where I take them on, I have this whole entire exercise that I do with them that looks at what your life looks like in 10, 15, 20, 30 years, depending on how old you are, and what you want your life to look like. And then we get to decide if you're going to get there or not. Right? Because there's enough data for us to say, with about 85 to 90% certainty, if you say, listen, I want to live to be 85, I want to be able to get on the floor with my grandchildren and play with them and be able to tell them stories that I remember from my childhood, and to be able to, go fly and get on an airplane and be able to put my bags in the cupboard. And I want to be able to, spend time with my friends and not be in a nursing home and not be in and out of the doctor's office. If that's where you want to go, we can absolutely, we can get you there. Like, it's not even a question. That is absolutely doable. But if you aren't willing to do the work, I can also tell you with almost pretty good certainty how not to get there, right? Like, how to end up in the doctor's office, how to end up not being able to sit on the floor. But if at the end of the day, you're like, you know what, I'm good. I'm out of here at 60, and I don't want to live longer, and I don't want to live a life that, without pain or suffering. And some people choose that, right? I just want you to know that once you get to that point, it's so much harder to reverse than to be proactive. And just to be aware that when you go to your doctor, these are the limitations of your doctor. So if you do get diabetes, the doctor can give you medications for it, but it's not necessarily going to lengthen your life or the quality of your life. We'll get your blood sugar down.
Yeah.
So as long as we're all on the same page, right? I want you to make an informed decision. And that's all I ask of my patients is like, hey, listen, I want to get you to where you want to be, not where I want you to be.
I love that approach. I never really thought about it in that way, but that's a good way. I've joked with people and said, I lift weights because I still want to be able to get up off the toilet when I'm like 80,
So here's the thing. Okay, so this is a real thing that I think we need to, like, verbally. I don't want to jump over this. If you want to be able to get off of the toilet and you're 85, It's not going to happen if you're not intentional about it. Like your bodies, as women, our muscle mass decreases every single year. Our testosterone level decreases every single year. That is a natural part of aging. But let's not get that confused with your ability to counter that, right? So if you want to maintain your muscle mass, if you want to be able to stand up and walk without pain, it requires you to resist. I know I was going to use the word fight, but I don't want to say that. It's not a fight. For you to resist the natural stages of aging, and it's absolutely doable. But we have to be proactive. And the reason I didn't want to skip over this is because for 40 years of my life, and probably 40 years of your life and plus, you've been able to do whatever you wanted, whether you worked out or not, and you probably have been able to function pretty well. You've probably not had an issue per se standing up, getting off of a toilet, getting off the floor. And the assumption is that the next 40 years will be the same. The problem is that around age 40 is also the time when the hormones that allow you to do this start to plummet. And they don't just like gradually go down. They just like they go from you have the hormones that help you maintain your muscle mass, your clarity of thought, your disease-free state, to not having any. And the consequence of that is that disease develops. And that's why after a certain time, your body starts to break down, and everybody comes, in the hospital, and they'll say, I was fine until.
Yes.
I was healthy. Like, oh, you don't know how many times I was in the hospital this week. And one of the ladies, she's 70 years old, and she came in and she had a stroke, and she was like, I've been healthy my whole entire life. And what I wanted to say is, no, you haven't. Because if you had been, you wouldn't be in here. It took 20 years for you to have this stroke. It took 20 years. And I could have told you 20 years ago, this is what we do to prevent the stroke. But you were living your life and you weren't being intentional, and it's not your fault. But that's what I want people to know is that your health is predictable. We can see how these things are going to pan out based off of the way you live your life, the foods you eat, how you manage stress, how you move, the community you're around. I have 7 specific things that I focus on that are modifiable, that if we start to address early, it's not hard. It's just gradually getting better day after day instead of getting worse day after day.
Okay. And I do want to ask you about the 7 things, but I had another question.
Yeah.
Okay. Because we started talking about this hormones, and oh God, it's so overwhelming to me. And I think to a lot of women who are kind of in that space where I am, perimenopause. I mean, I'm over 40, but so I'm probably on the later end. We don't understand what's going on. I don't think doctors have really told us what's going on. We don't know about like this whole hormone replacement therapy. I remember recently having a discussion with an aunt of mine. She's about 70. Yeah, she's 70. And she told me she had hormone replacement, I don't know how many years ago. And it didn't go well for her. And she just looked at me and said, don't do it. But then I'm hearing, a lot of discussions, podcasts, or whatever, encouraging women to try it. And now that I'm in this space where I could probably use some help, I'm just confused. Like the
Yeah.
information is all over the place. So anywho, can you just chat with me a little bit about hormone replacement therapy?
Absolutely. And we're going to take a little quick history lesson. So
Okay.
before 2002, all women, 80% of the market was hormone replacement therapy for drugs. And because we knew that hormones decreased as we got older and that women were having hot flashes and insomnia, and we were like, okay, when you hit menopause, go on hormones. In 2002 was the release of this study called the Women's Health Initiative. And I won't go into like the details of this study, but what we found was that it was stopped early because of fears of increased rate of breast cancer. The study wasn't even looking for breast cancer per se. It was looking for its relationship in heart disease, but nonetheless, there was this trend towards breast cancer. And after the data was really pierced apart over the last 20 years, we found out that the data was inaccurate. and there are lots of good reasons why I can go through, but we won't spend a whole lot of time. But just know that if you look at any of the data since that study came out, you'll see why so many people are challenging the results of that study, because it actually did not show that the rates of breast cancer went up. It had to do with very specifically the types of hormones they were using, the route of administration that they were using, as well as some funny business with the way that they were looking at the numbers. With that being said, the past 20 years, people have been saying, well, women are suffering. Why aren't we putting people on hormone replacement therapy? And the standard for all physicians was no, hormones cause breast cancer. And so if you talk to any physician out there who has not looked at the subsequent studies since that study, they're all going to say, no, hormone replacement therapy causes breast cancer. So that's why nobody's talked about it, is because there's been this big fear. And so that's why I say you had to get special training or understanding of, number one, the Women's Health Initiative, but also the studies that came after it to fully understand. So let's fast forward to current day. What we're seeing is a lot of people saying, listen, because of what we know about the study, if we don't give estrogen in the same way that they gave it in that study, which was orally, if we give it topically, if we give it with progesterone, and this is a controversial topic to give or not to give with progesterone, but if we give it with oral progesterone, and then also even more new is adding testosterone in there for the purpose of muscle strength and other benefits, sexual libido, etc., then women should at least be given this, offered and told what the risk and benefits are so that they can make informed decisions, right? Because women are suffering. And so now we're in this place where if you know a little bit about hormones, you can now start to talk to your doctor about it. It's not as taboo, but you'll still find a lot of doctors who are like, no, I'm not giving hormone replacement therapy. So what I usually tell people to do is find a doctor who's been trained in hormone replacement therapy. Now, and there are two separate camps. There are probably more than this, but two main camps. You have the Menopause Society, which has pretty, they're the standard, right? So we all doctors, they follow sort of a society, and there's the Menopause Society, and they have recommendations about how to prescribe hormones. I was trained under functional medicine and anti-aging medicine, and they have a slightly different approach. And the difference oftentimes has to do with bioidentical hormones. It might have to do with using compounding pharmacies or not using compounding pharmacies. I do sort of both. I'm kind of a splatter between the Menopause Society and functional medicine. But any doctor who's willing to talk to you about hormone replacement therapy, I think you need to be. So the last piece I want to say about this is, when, should you even go? Like, what if you're, in two cases, should you even go and talk to your doctor about it? And my answer is always going to be absolutely yes. There are too much data that suggests that having hormone replacement therapy within the first 10 years of menopause has significant outcomes on not just quality of life, but length of life. So because of that, this is why I'm so passionate about it, because I want particularly Black women to not be late to the party here. I don't want us to be 10 years later, and now that the Menopause Society or now that conventional medicine has jumped on the bandwagon, that now is the only time, 10 years or 20 years from now, that us as Black women are made aware that this is an option for us. We absolutely need to be talking about hormone replacement therapy at the time of menopause or even before, in that perimenopausal state, so that we can start to talk about it and then go on it if we find it's right. And in my opinion, it's right for probably about 95% of the population. So this idea that we should be scared of it, we should, avoid it at all costs or only be on it for the shortest amount of time, I'm not a person who ascribes to that. I'm, always open to have that conversation because it is a controversial topic. But I also know that as a woman, as a mother, as a daughter, will be on hormone replacement. I am on certain hormone replacement now, even as a perimenopausal woman. And, if my mother was in that 10-year window, she would also be on it. But I suggest it for my patients as well. So I hope that answered your question in sort of a
Yes,
long
yes. And I
way.
have so many questions.
Yeah.
I love this. I love this. Okay. Um, I'm gonna kind of use myself as the guinea pig
Okay.
here, and I overshare on this podcast, so the listeners know. All right.
Okay.
So let me make sure I understand. We can start uh, uh, exploring this if we're perimenopausal, correct?
Yes, so I think
Okay.
there are a couple of things to think about when we're talking about perimenopausal, because even premenopausal, there are some hormones like progesterone that some women may benefit from. So
Okay.
you can start talking about this at any stage, depending on what's going on in your health. When you're in that perimenopausal state, if you're having symptoms, I think, before going on again, talk with the doctor, but I'm using this loosely. Before going on like an antidepressant, a sleeping agent, and all these other medications, you may want to consider maybe hormones instead, right? So if you're already starting to have issues in that perimenopausal state, then I would say, yes, let's talk about whether or not adding a little progesterone, maybe even some testosterone, might be a good start for you. As you get into later perimenopause, so this is towards when you're closer to menopause, where you might be skipping cycles. Maybe you go 3 or 4 months and you think you're all done, and then that period comes back up. At that stage, and if you're having hot flashes and insomnia and vaginal dryness and low libido and all those things, then maybe at that stage consider adding in estrogen there. But then after you've gone through menopause, and let me just give the definition here, because I think this term perimenopause and menopause and postmenopause are not very clear. So perimenopause is about that 10 to 12 years before you actually go through menopause. Menopause is one day. It is the day that you go 12 months without a period. Everything after that is postmenopause. So the word postmenopause and menopause can be used interchangeably, but it all is based off of 12 months without a period. So everything before that, potentially it's perimenopause. Now, there isn't really a special lab that lets you know you're in perimenopause. You know you're in perimenopause because you've been paying attention to the way you feel. You've been noticing increased fatigue, brain fog. You've been noticing weight gain around the midsection. You've been noticing your blood pressure and your cholesterol going up. You've been noticing problems with sleep. So these symptoms are coming up and you're like, what's going on? And you're like, oh, it's my hormones, right? So, but the thing that women need to know is that can happen 10 to 12 years before menopause, right? So you could be 38 and be going through perimenopause. That might be early perimenopause, but you still need to be aware of that. So that's how we kind of gauge perimenopause, menopause, and postmenopause. And yes, during perimenopause, depending on what's happening, then you may want to try hormones in addition to other therapies. Now, one last caveat here. So I am a lifestyle medicine doctor through and through. I consider myself to be integrative because I integrate the best of conventional and alternative medicines. But one thing that I absolutely do know is that your lifestyle affects everything.
Yes.
So what happens is that oftentimes when women are in perimenopause, if they're not willing to change their diet, they're not willing to change how they move, they're not willing to talk about how they manage their stress. And in that case, throwing pills at it is not going to be the solution, right? So for me, and in my practice, and what I recommend people to look for is somebody who's going to take a holistic approach and say, well, how is your food affecting whether you're tired or not? Do you have good stress management techniques, right? Because if your stress management technique is to go eat every time you're stressed, then it doesn't matter what pill I'm going to throw at you, it's not going to help with that, right? So we want to address the root causes of why people have their symptoms and then think about hormone replacement therapy as an adjunct.
Okay, got it. Oh gosh, this is so helpful, doctor. Okay, so I'm gonna just throw myself out there as an example. 51. I It's been a while since I had a period, but it ain't been 12 months. Okay,
Okay.
so I could be at the late end. Um, I don't really have a lot of symptoms. I don't have night sweats. Um, I mean, I get moody, but I've always been moody. So I don't know. But like generally speaking, I feel pretty good. The one thing I do have is low libido. That is true. So I'm just going to share this. Back in the spring, I think it was, I went to my doctor. I went to my OBGYN. She ran a hormone panel. She told me that my testosterone is low. It is low.
Mm-hmm.
Um, I asked her, well, what can I do? And she said, well, I use pellets. And I said, okay, are there any other options? And she said, none that I'm going to give you. So basically, she's just saying all she does is pellets. And so I said,
That's
okay,
interesting.
yeah, I said, okay, thank you. Because if
Mm-hmm.
you're not going to let me know what else, there's no other options other than coming in here. And because I
Hmm.
work out, she said I would have to probably come in every 60 days, as opposed to somebody else that might have to come in 90 days. That's the only option I have. So I just,
I think that's really interesting because it's so hormone replacement therapy is a very controversial topic, particularly testosterone. This is a much newer nuance. There's always been this idea that if a woman takes testosterone, that they're going to bulk up and all this stuff, and that has such a negative connotation.
I'll take it. You know?
But the reality is that we make more testosterone than we make estrogen. Right. So we have this sense that testosterone is this like male hormone. It's just because men make so much more than women. But testosterone is very much a female hormone. Right. We require it for certain things. Right. Including libido, including muscle strength and muscle mass, and not necessarily to bulk up. I mean, I'm a very thin woman. I'm never going to be
Right.
a muscle maniac, and a little bit of testosterone is not going to do that to me, right? Now, if I take super physiologic doses, possibly, but I'm not taking those doses, right? So, but what I was going to say about this being a controversial topic is that pellets are even more controversial. So it's kind of like, for her to be like, I'll do pellets, but I won't do creams, is interesting. So the only one I don't do is IV, or IM, so that the IM pushes, or they give you a shot for it. But I do creams, and I'm more of a cream person than I am a pellet person. Not because pellets don't work. I think pellets are amazing, and pellets do work very well for a lot of women. The issue that I tend to have with pellets is that I do test lab levels, and your lab levels can get really astronomically high with pellets. And I don't know that we have enough data to tell us what the long-term effects of that are going to be. I don't think that they're going to be bad, long-term effects. I mean, oftentimes the most common side effects of taking testosterone are things like acne, excess hair growth, male pattern baldness. So those sorts of things are easily reversible. So those are the side effects that we tend to know. And I know lots of women who are on pellets who don't have any of those symptoms. So the question is their testosterone being that high even a problem? I don't really know the answer to that. But my experience has been no. My experience has been that women can take pellets and they are completely fine. So I do recommend pellets for some women. I just don't do them because I'm a virtual practice. But as far as topical goes, I think a lot of women get a lot of relief with just the topical. And so it's like, do I need to push their testosterone levels to these, over 100? Or can I get them between like 50 and 80, which is still what a lot of people would consider to be high. But that's where I try to get women between 50 and 80 with their levels. And you can do that with the cream just fine. So with that being said, for your situation, the other option for you would be a cream. I wouldn't be opposed to you doing a pellet if you really, were like, I really just want the ease of a pellet. But if you were saying, I don't want to quite go to a pellet yet, maybe start off with a little lower dose, then a cream is a great place to start. And I think that, most women are low in their testosterone. And if you are symptomatic on top of that, then yeah, absolutely treat.
Yeah. I mean, like I said, the biggest symptom I have is low libido. Um, but I felt like, and I'm just going to be honest, I ain't going to say her name. I felt like her only option being pellets was because she would make some money from those pellets.
It's
I could
probably
be.
no. So okay, I have a whole. I don't want to get on a digression here, but I often hear people talk about like doctors like trying to do things to make more money, and it's really not true. I mean, there
Okay.
are some scenarios, but like it's just like doctors really don't make more money doing certain things. Now, for me, I don't take insurance, so I'm a cash practice. So yes, I run my practice like a business, and obviously I need to be able to, make a profit to be able to keep doing what I do. But I make a lot less than if I were to go work in a hospital, right? So it's not like I'm gorging or surging my prices to make this astronomical amount of money. And so oftentimes I find that people make decisions based off of their comfort level. So what I hear when she says that is not to think the worst, that she's trying to gorge you for profit. I'm thinking she's comfortable with pellets. That's what she likes to administer. That's her experience level. Why push her out of her experience level, right? And so I think for a lot of women who want pellets, it's great. And if you don't want pellets, you find somebody who's willing to write you a cream, right? So I think that that's really the easiest way to explain that. I think.
Okay, I'm glad I brought that up because she's been my OBGYN for a long time, and I was really disappointed. And I was thinking, gosh, I got to switch. But I don't necessarily have to switch. I just need to find someone who is, because I would prefer to start with a cream.
Mm-hmm. Yeah.
Honestly, I don't want the pellet. So I just need to find someone else. Maybe I found that in you. So I'll be giving you a call.
Yeah, I think here's the other thing. Here's the other thing about it. And I believe this about all medical practice. You have to find a team of physicians and healthcare providers, because it's that team that's going to help you get to where you want to be. And so I don't ever feel like there's a competition between doctors, because what you do really well is what you do really well. What I do really well is what I do really well. And I really like the way that I practice. And I made me think of something when you were saying, I don't really have a lot of symptoms. There's probably a reason you don't have a lot of symptoms, right? You don't have a lot of symptoms because you take care of yourself, you work out, you eat fairly well. I'm guessing, I don't know all that about you, but I know enough about you that you're created a podcast. You must be caring enough about your health to be doing the things to prevent you from having symptoms. So that also is a testament to how powerful lifestyle can be. And I really do. I look for patients who want to use their lifestyle to feel better and use supplements or hormones as a supplement, not as their primary go-to. And most doctors, because what we're so used to doing is prescribing, they were more than happy to take the patient who's like, I just want the hormone. Don't tell me about what to eat. I don't want to change what I'm doing. I don't want to change my behavior. So I'm not the doctor for them, right? So that's why I'm saying it's a team. It's always a team.
Okay. That is great. I'm glad I brought that up. Okay. So and just so I'm clear, the 10-year time clock starts ticking once you hit menopause.
Yes.
Okay. Because I had heard that before, but I was confused. I thought it was the 10-year clock started when you were in perimenopause.
No. Once you hit menopause, and there's a couple of studies that say that your risk of cardiovascular disease goes up after 10 years. But if you get a coronary calcium score, let's say you are 10 years past menopause and you're like, oh, I really wish I was on hormones, then, there are some things that you can do to evaluate your risk of coronary disease or heart disease, and then maybe still go on hormone replacement therapy. But again, there's just not a ton of research. So a lot of what doctors are doing is basing it off of clinical experience and the amount of data that's out there. So with any of this that I'm talking about, number one, you've got to talk to your doctor about it or your prescribing physician about it. You got to talk about the risk and the benefits. You got to talk about the efficacy of the data, right? Like everything that I do isn't FDA approved. Everything I do isn't certified by the Menopause Society. And it's important that we talk about what that means, right? And this is important when you talk to any physician. It's important for you to understand what the risk and the benefits are. And I bring that up because there's this big controversy about whether or not hormone replacement therapy helps with brain health, whether it actually prevents heart disease, whether or not it helps with other chronic illnesses. And I'm of the belief that they do. Like by being on hormone replacement early enough actually will reduce your risk of coronary disease, may improve your risk of for dementia. And there is no real solid evidence to give me a foundation for me to say this is conclusive. but there's enough data to say this is likely and that we'll probably find out the answer to this in the next 10 to 15 years, maybe 20 years, but they're never going to study it. They're never going to do another women's health initiative to look at these factors because it was so expensive. And so we have to make clinical decisions based off of the available data and take risk when the risks are worth it, when the benefit outweighs the risk. So that's why these topics can be a little controversial, but we can still make informed decisions based off of the data we have.
Okay, great. Oh, I love this conversation. Now, I got to be respectful of your time, but doctor, I wanted to ask, is there anything that you wanted to share that we haven't discussed at this point?
Well, no, I do. So I want to talk about the 7 things.
Yes.
Yeah,
Thank you.
And the reason I want to talk about, because I want people to know what they can actually do to improve their health, right? Okay, so I created this thing called the People's Life Prescriptions. And I say that because I prescribe health. Usually you go to the doctor and it's like we're prescribing prescription medications or surgery. But if you are interested in being prescribed health, how to be healthier, how to maintain health as you age, you have to hit the modifiable risk factors. Now, there are more than 7, but these are the ones I think are most potent and cover the most amount of things. So the first one is called personal life. That has to do with your intention. A lot of time people think this is very woo-woo and it's like, oh my gosh, I have to change my mindset. It's actually very important at a biochemical level. Everything I tell you is always going to be something related to biology or chemistry. There's a good biologic explanation, even though it sounds like, how I think impact my weight? It absolutely does. You're just going to have to trust me that I know the research on this. But so intention is really important. So that's personal life. The second one is food life. And it's not just about calories in. It has to do with nutrients. It has to do with the foods that you eat, the foods that you don't eat, and the timing of when you eat. The next one is fit life. Fit life is all about fitness, but not in the way that you might think. It's really about movement, right? So how much are you moving? If you sit on your butt all day and then go to the gym for the hour, you're going to have worse health outcomes than somebody who doesn't go to the gym but moves all day long. So you have to understand that. And then as we get older as women, we have to understand that what we need to do for our fitness changes as our hormones change. So the same workout that you did when you were 20 is not going to work when you're 50. You've got to be able to understand that. And we as a medical field are just beginning to understand it. So if you're going to people who are like, oh, you just need to train the same way that the 20-year-old trains, they don't know the new research, and it's not their fault. It's really new research. We're just starting to research women in this way. So the next one is sleep life. This has to do with sleeping and creating a sleep regimen, understanding the impact that sleep has on your weight, on your mindset, on your stress levels, your health, all of that. The next one is resilient life. That has to do with stress management. Now, this is another thing because oftentimes people think, oh, there's nothing I can do about stress. Stress is around me and there's nothing I can do. But you have to think, as a mother, I think, oh, am I teaching my kids skills to be able to manage stress in their lives? Most of us aren't. Most of us weren't, right? But if you think of other cultures, a lot of cultures, Indian cultures, Chinese cultures, they teach skills as you're a young kid on how to manage stress so that stress doesn't always overwhelm you. Now, that's not universal. I'm not going to say
that is, yeah.
But the idea that there's nothing we can do to help us manage stress just isn't true. And it's not stress on necessarily a pie in the sky. I'm talking again about biochemistry. I'm talking about cortisol levels. I'm talking about estrogen and progesterone and testosterone. I'm talking about how do you actually address your nervous system in a way that benefits your health. So stress resilient life is really about that. The next one is going to be detox life. And this is a topic that doesn't get talked about enough. It's about the toxins in our environment. Again, this is one of those things that we cannot completely erase from our experience. It's like we're going to be exposed to toxins, but we do know that particularly for Black women that our beauty products are full of toxins that lead to things like fibroids and endometriosis and cancers. And so really talking to Black women about what are you actually using on your skin? What are we doing to our hair? What are we doing? And understanding how those toxins affect our overall health. And then the last one is community life or connected life. And that is really about the people you're around. And if you don't think that that's important, we know that loneliness increases your risk of overall death by up to 50%. So if we're really thinking about how do I live a long, healthy life, who you surround yourself with is going to be really important. And so those are things that you have control over. Doesn't require a doctor's prescription. But this is what I found it does require. It requires support. Like, it's one thing for me to tell you what to do, but it's another thing for you to actually go home and implement it, and to be able to navigate as you're trying to make these changes. Because the changes in the beginning, they can seem overwhelming. They can feel like, oh, what am I supposed to do? And what did TikTok say? And somebody on Instagram said this, and then wait, so my best friend told me not to do that, and you're going to get unhealthy if you do this. There's so much fluff in the environment that really being able to say, okay, this is what I'm going to do. I'm going to see how it affects my body because I'm the expert on my body. And then I'm going to make a decision on how I'm going to incorporate this lifestyle behavior moving forward. And how can I make it something that's natural and normal for me to do and not a burden or tiresome? That is the heavy lifting. And so that's where I try to say to people, find a community. It doesn't matter if it's working with me or if it's working with your health coach or wherever, but you need to find a community that's going to help you get there, because we got to get there if we're trying to get results, right?
I love it. And all 7 of those things are things that I like to focus here at the Go Hard Chick podcast. I say we focus on the 8 pillars of wellness, but everything you named are things that are important and that I try to encourage the listeners we got to work on, So I love that. Thank you, doctor. But before you go, I want you to share with the listeners, how can they find out more about you? Maybe maybe they need some help and they want to come and hire you for your services, or they want to follow you on Instagram. How can they learn more?
Yeah, so you can follow me anywhere at Dr. Nicole Peoples. So that's DrNicolePeoples. So Dr. Nicole Peoples, that's on Instagram, on Facebook, on LinkedIn. That's also my website, Dr. Nicole Peoples. And I'm a completely virtual practice. So one of the things that I really focus on is something I call physician-directed health coaching. So I have a really great health coaching program. It's actually releasing soon, but it's called the Black Women's Guide to Health, Hormones and Longevity. It's a group program that helps you do exactly the things that I just described. It helps you figure out what you're supposed to be doing for your health, tapping into your own hormone intelligence so you understand how your body is either working for you or against you, how to change your diet so that you can lose that extra 20 pounds, how to maintain your weight if you're not trying to lose any, and how to reformulate the way you live your life as you go through perimenopause and menopause. So that's my big flagship program. And if you're interested in hormone replacement therapy and you are a Georgia resident, and you are also interested in doing it in a holistic way, then you can always go to my website and get more information about how to become a client.
All right. Perfect. Thank you, Dr. Nicole Peoples. You're a rock star. This was great, super informative. This is something the listeners have been wanting to hear and learn more about. So I am very, very grateful.
Thank you for having me. And I love to talk about this stuff. So anytime you want to talk about anything else, let me know.
Yes, we will definitely bring you back. Before we conclude this episode, I want to give a massive shout out to our incredible Go Hard Chick community. Your support fuels my fire, and I am so grateful for each one of you. If you love what you're hearing, share the love. At the heart of this podcast is the belief that we can all live a happier, healthier, and fuller life. So we need the word to get out to as many Go Hard Chicks as possible so they too may gain valuable information by being a part of this community. And of course, leave us a rating and review on Apple Podcasts or rate us on Spotify. It really helps. Until next time, Go Hard Chicks. Take care.